UofL Health is here this week to talk about a common health condition that affects people of all ages, but it doesn't have to last.
Yeah, we're talking about chronic tendon pain. Dr. Jordan Hilgefort is here with us this week to tell us more about a procedure that can actually help you out, and it's called TenJet. Doctor, thanks for being here, first of all.
Thank you for having me.
Tell us what this is. It's interesting.
Yeah, so TenJet is a procedure we use. It's minimally invasive, and we use ultrasound guidance, so some image guidance, in order to guide an instrument that uses pulse saline or salt water to help break up and remove damaged or diseased tissue within these tendons. Tendons are what connect our muscles to bone.
Right.
So for patients that have had these long-standing overuse injuries of these tendons or plantar fascia, so plantar fasciitis, it can be quite helpful in trying to eliminate that condition moving forward.
Tell us who exactly you might be speaking to here. Whose ears should be perking up because they might be a good candidate?
Yeah, so specifically I'd say these are patients that aren't necessarily dealing with issues just in the short term, so the couple days or even couple weeks, but rather patients that have tried things like rest and anti-inflammatories, modifying their activity, or maybe even have already done some physical therapy or injections and are still just dealing with this persistent kind of nagging discomfort. That said, we've really done this procedure on patients as young as their mid-teens, upwards to their 70s or 80s. So I'd say athletes to even your active community workers or everyday individual just trying to get back to their day-to-day life pain-free.
And what can the patients expect with the procedure, from getting ready for it, the procedure itself, and then after?
Yeah, it's a great question. So I meet with them in the clinic first for a consultation to go over and really make sure we're diagnosing the correct pathology first. I think that's what's most important, to make sure that we're addressing what you need before we make you undergo any type of procedure. And then second to that, when we do the procedure, you're not put to sleep. We use some local lidocaine or a numbing medicine, similar to if you've had any dental work done, that numbs the area so you don't feel discomfort. We make a small incision about the size of a pencil eraser, and we introduce the instrument into there, uses pulse saline or salt water to break up that tissue, and then recovery from that standpoint is upwards to 3 months, but I tell patients within a couple days you're back to doing all the normal day-to-day activities you would like, with improvements in pain and swelling that you otherwise might not have with a traditional open surgery.
And what's the success like? Is it almost guaranteed to make you feel better?
Yeah, so I tell patients my goal is for everyone to get about 80% or more better. Obviously, we'd love to take away all that pain and discomfort, but sometimes when you're dealing with years and years of chronic pain, it's not always possible to eliminate that completely. But I will say we've had great success with patients thus far on a number of different body parts. So rotator cuff, tennis and golfer's elbow, Achilles tendonitis, plantar fasciitis, in great numbers. And we've been able to help a lot of people.
That's awesome.
Fantastic. Thanks so much for coming on and filling us in on this new technology you guys
Thank
can
you for
offer.
having me.
We
Thanks,
appreciate
Doctor.
it.